Hello guys, good evening everyone. So in this video we will see 30 multiple choice questions. Very interesting and new questions are here. So the first question is the type of hypersensitivity reaction due to IgE mediated histamine release is called. So the options are type 4, type 1, type 2, type 3. So the right option is option B, type 1 hypersensitivity reaction. So it is mediated by the IgE antibodies. So type 1 is the IgE antibodies. So the next question is a normal average infant, the percentage increase in body length then at birth at the age of 1 year. So in a normal average infant, okay, the percentage increases body length then the birth. Okay, so how much length will be at the age of 1 year? Options are 20%, 10%, 50%, 75%. So the right option is 50%. So 50% increases at the age of 1 year of a normal average infant baby. The next one is a multiple sclerosis is characterized by. Options are impaired cerebral circulation, deficiency of neurotransmitter that is dopamine, deterioration of the spinal column, progressive demyelination in the central nervous system. So what will be the right one? The right option is option D, progressive demyelination in the central nervous system. So demyelination is nothing but the neuron which is present, okay, just think it is a neuron. So the neuron is covered by the myelin sheath. So in this condition, multiple sclerosis, there is a progressive degeneration, okay, otherwise demyelination is nothing but decreasing of cells in the myelin sheath, that is demyelination. So the progressive demyelination seen in the central nervous system, it is by the multiple sclerosis. It is a character of the multiple sclerosis. So the next one is a in the diagnostic statement, excess fluid volume related to decreased venous return as manifested by lower extremity edema. The etiology of this problem is options are edema, idiopathic, excessive fluid volume, decreased venous return. So the right one is option D. Decreased venous return, it leads to the excessive fluid volume. Okay, so this one is the right answer. The next one is the introduction of solid foods along with the breastfeeding is called scheduled feeding, complementary feeding, conditional feeding, demand feeding. The right one is a option B, complementary feeding. So along with the breastfeeding, we will give some solid food. Okay, it is nothing but a complementary feeding, additional feeding for the baby. The next one is a voluntary rejection of unacceptable thoughts or feelings from the conscious awareness is called suppression, substitution, sublimation, symbolization. The right one is option A, suppression. So the suppression is nothing but when the mind, when the person's mind are ready to take a bad news. Okay, a bad news. The person is ready to take a bad news, but already know about the bad news. So what he will do in order to reduce the stress, okay, depression or sadness, everything, whatever the sad is rise from the bad news. So he wants to he wants to change the mind into the a new a funny things or some happy moments are remembering, so like that. So in order to reduce the sadness by the bad news, he is looking at the new comedy things, otherwise new things which will avoid the sad, that is suppression. The next one is the professional value of nursing that describe the right to self determination is called. Options are altruism, dignity, integrity, autonomy. So the right one is the autonomy. So autonomy is nothing but a professional value that describes the right to self-determination. I mean, self-determination is nothing but self-decision. The nurse has the ability to take the self-decisions. Okay. So in critical situations, not in every time. Next one is which of the following is a mortality indicator? Options are disability rate, crude death rate, incident rate, prevalence rate. So the right one is option B, crude death rate. So it is mortality indicator. The next one is the term mRSA in bacteriology stands for multidrug resistant Staphylococcus aureus, methicillin resistant Streptococcus angioides, methicillin resistant Streptococcus aureus, methicillin reactive Staphylococcus aureus. So the right one is option C, methicillin resistant Staphylococcus aureus, MRSA. The next one is a fine downy hair normally found abundantly in premature babies is called. Options are caput, lanigo, navy, and vernix. So the right one is a lanigo. Lanigo is nothing but a fine hairs are present in the baby skin. Okay, it is nothing but lanigo. The next one is which of the following does not help in controlling hazards in school setting? Options are food supply to the student should be safe, the school should be built near source of noise, the school should be well ventilated, health education should be included in the curriculum. So the right one is option B. Option B is the school should be built near the source of noise. Why? Because the school should be away from the source of noise. Source of noises are nothing but factories. Okay, factories or some music, music concerts, some function halls like that. So it is not correct. So does not help in controlling of hazards of school setting. The right one is the option B. The next one is lactational amenorrhea act as a contraceptive method by. Options are preventing sperm entry, spermicidal action, preventing implantation, preventing ovulation. So the right one is option D, preventing ovulation. It is due to the lactational amenorrhea. So the lactational amenorrhea is nothing but when the mother giving breastfeeding for the baby, what will happen? It will act as a preventing of the ovulation. Okay, it is nothing but lactational amenorrhea. The next one is the anterior fontanella closes by. Options are 2 months of age, 9 to 18 months of age, birth, 2 to 3 years of age. So the right one is option B, 9 to 18 months of age. So this is the anterior fontanella, this is the posterior fontanella. Fontanella is nothing but the opening or otherwise the gap between the bones. Okay, so after some months the bones will grow towards the fontanella. Okay, so like that the bones will be closes the fontanellas. The next one is a positive Brudensky and Kerning sign are indicative of. The options are hemiplegia, peripheral neuropathy, meningitis, alcohol intoxication. The right one is a meningitis. Okay, so the right one is meningitis. So in the case of meningitis, we can see the Brudensky and Kerning sign positive. The next one is which of the following is a confirmatory indication of pregnancy? Options are amenorrhea, fetal heart in ultrasonogram, beta HCG in the urine, nausea and vomiting. The right one is option B. Option B is the fetal heart in the ultrasonography, which will give a confirmation diagnostic method for the pregnancy. The next one is among the following the bone that belongs to the axial skeleton. Options are humerus, patella, hyoid and tortoise. Okay, options are the right one is a hyoid bone. So hyoid bone is belongs to the axial skeleton. Axial skeleton is nothing but appendicular skeleton and axial skeleton. We have the two types. Okay, so appendicular skeleton is the appendicular axial skeleton is made up of the bones in your head. Okay, so head, neck, back is nothing but vertebral column and thorax. Okay, the skull, vertebral column, thorax. So these are called axial skeleton. So other than these bones are belongs to the appendicular skeleton. So in the hyoid bone is belongs to the axial skeleton. Okay, hyoid bone is belongs to the hyoid bone is belongs to the axial skeleton. The next one is an example of positive feedback mechanism in our body is. Options are baroreceptor mechanism, temperature regulation, regulation of the thyroid hormone, oxytocin in the childbirth. So the right one is option D, oxytocin in the childbirth. It is nothing but positive feedback mechanism. Okay. The next one is which of the following is not a sign of respiratory distress? Options are speaking complete sentence, nasal flaring, changing of posture to easy breathing, and cyanosis. So which is not a sign of respiratory distress? Okay, understand the question. Not. The right one is option A. So when the person is having the respiratory distress, he cannot speak a complete sentences. Okay. The next one is the most common cause of retinal detachment. Detachment is nothing but the retina is separating from the cornea. The right options are diabetes mellitus, degenerative changes in the retina and vitreous, brain tumors, trauma. Sorry, it is trauma. The right one is option B, degenerative changes in the retina at the vitreous. The next one is pepsinogen in the stomach is secreted by. Options are chief cells, G cells, goblet cells, parietal cells. So the right one is option A, chief cells. So the chief cells are produce the pepsinogen. So we will see a tissue of the gastric stomach. Okay, the stomach tissue is looks like this. So in this tissue, we have the different colors of cells. So among those, the goblet cells are which produce the mucus. So here we have the goblet cells are here, okay, light blue color. And the next one is the parietal cells which produce the HCl, that is hydrochloric acid. So here we can see the parietal cells. These are the parietal cells. And the chief cells are the pepsinogen, D cells somatostatin, G cells are gastrin. So these are the 5 types of cells are present in the single tissue of the stomach. The next one is the first referral level in the healthcare system is, options are secondary healthcare, tertiary healthcare, primary healthcare, primordial healthcare. So the right one is option A, secondary healthcare is nothing but first referral level of the healthcare system. That is from the sub-center to the PHC. Okay, so PHC is nothing but secondary healthcare, that is first referral level. The next one is when person blood pressure drops and the kidney responds by the, options are slowing the releasing of ADH, producing aldosterone, secreting renin, increasing urine output. The right one is option B. Option B, producing aldosterone to the by the kidney respond by the blood pressure. Okay, when the blood pressure is decreases, the kidney responds to release the aldosterone, so which will increase the blood pressure.